In this audio lecture, we're going to be talking about continuing our discussion of urinary tract obstructions, focusing this time on tumors, and specifically focusing on a cancerous tumor, meaning it is malignant, a Wilms tumor, the most common type of childhood kidney tumor. So, what is a Wilms tumor? A Wilms tumor is also known as a nephroblastoma. It is a rare condition. It affects children, okay? And it's rare in that it only results in 500 cases per year. It usually affects one kidney. It's not malignant. It is a benign tumor, okay? But it can impact kidneys substantially. Right? Most of the time it affects children about ages 3 to 4, affecting the one kidney. 4 to 5% of cases it affects both kidneys. So the Wilms tumor has genetic causes and spontaneous causes, meaning that genetic causes can be found on chromosome 11 and or X. And the one important thing to note here in your textbook that I don't think points it out is that Wilms tumor is a dominant allele. Okay, so it only requires one copy of that allele to develop this phenotype. And so it occurs, the females only require one copy, males only get one X chromosome, and so we could find it occurring in both of equal likelihood. Okay. We have some characteristics down here for manifestations or associated conditions that are only associated with men, and I'll get to those in just a second. Spontaneous would mean that there's a mutation during DNA replication when the cells were dividing. So it is the most common form of childhood kidney cancer. It is a very curable form of childhood kidney cancer as well, 80 to 90% recovery rate. So it is associated with conditions like anorexia, which is a loss of the iris. So if you recall back to anatomy and physiology, the iris is the colored part of your eye. Okay. We have hemihypertrophy. Hemihypertrophy is really an increase in size in one half of the body, so like a longer arm than the other arm. Okay. Cryptorchidism. So cryptorchidism is when the testicles don't descend. Okay, so that is only applicable to men or boys, since it occurs in children. And then we have hypospadias. So hypospadias is going to be the urethral opening being on the underside of the penis, and that these last two conditions, cryptorchidism and then hypospadias, is only applicable to males. Okay, so to boys. So, who's at risk? Really, we see African American men. Women are going to be susceptible. It is a rare condition. Okay, and then anybody who has a familial history. All right, so for manifestations, we see that they are going to include abdominal mass and pain, high blood pressure due to decreased ability to produce urine, hematuria, so blood in the urine. We also see other conditions like the hemihypertrophy, urinary tract infections. Individuals are going to be more susceptible towards them. Abdominal pain, nausea and vomiting, anorexia, constipation, okay, weight loss, fatigue. Right. So the secondary list that I just went through isn't as obvious, especially after we get down to nausea and vomiting and down. So the fatigue can likely be due to nitrogenous buildup in the body. Anorexia is due to nervous dysfunction. But the other manifestations I just listed aren't really obvious, but we can see that the manifestations that are listed on the slide are pretty obvious from results from the Wilms tumor. All right, so how are we going to diagnose this? So using information from our patient history, so looking at characteristics about their physical appearance, looking at really the size of the two halves of the body, and if one side is longer or larger than the other one, that may be an indicator. Okay. The absence of an iris is going to be an indicator. Physical examination. Now, if you palpitate the lumbar region, the kidneys generally so in the lumbar region where they're located, will oftentimes be tender and painful, and so you'll have abdominal or lumbar pain. We'll use imaging to visualize the kidneys themselves, and then we're going to be running some lab tests. And so these diagnostic tests are going to be really indicative of kidney function, right? So BUN is blood urea nitrogen, and creatinine, they are both waste products, and so they are normally passed through the kidneys and found in the urine. Now, this blood urea nitrogen is going to be increased, okay, and creatinine is also going to be increased in the blood as well, because glomerular filtration is going to be decreased. Remember that glomerular filtration was an indicator of our kidney function, right, of how healthy our kidneys are. And so we're going to run those two tests, looking at the blood urea nitrogen and the creatinine concentrations in the blood to make sure to look at filtration capacity of the kidneys. Okay. One other blood analysis we're going to look at, we're going to be looking for the complete blood count, because we're going to be expecting anemia to be present in this condition. And so if we see elevated levels of urea, elevated levels of creatinine, elevated or decreased levels of red blood cells, then this might all indicate that Wilms tumor is present. The anemia that we see is due to decreased erythropoietin, because now we have this tumor that is growing and is impeding on healthy cells. And erythropoietin stimulates erythropoiesis. Now we're going to be also conducting a urinary analysis, and so here we might actually look at creatine clearance. So how much creatinine is actually getting filtered through the kidneys and being put in the urine. Okay. And so really we have to look at all these various conditions before we can move on to treatment, because it's going to be suggestive or indicative of the stage that the Wilms tumor is in. So before we move on to treatment, we need to determine if the red blood cells were low, and so we would refer back to the complete blood count in the diagnosis. Okay. And so the staging, this treatment is based on stages, and so we have 5 stages for this Wilms tumor. The stages are going to be 1 through 5, 5 being the most severe. So stage 1 is going to be contained within one kidney. Okay, so this can be completely removed with surgery. Stage 2, the cancer is spread to nearby structures. Okay, it is completely removed with surgery. Stage 3 is going to be metastasized to nearby lymphatic structures. Okay, it may not be completely removed by surgery, so we're getting more severe as we are progressing up. Stage 4 is metastasized to distant structures, so beyond just local lymphatic circulation. This is going to structures like the lungs, the liver, the brain. The lungs and the liver are going to be 2 predominant sites for metastasization. Right? And then stage 5 is it metastasizes to both kidneys, meaning you're going to have severe renal impairment in stage 5. So treatment is going to be based on how progressed the tumor actually is. We're going to, if the first option is likely going to be surgery, right? If the chemotherapy and radiation do not work. So surgery can be used, and we can have simple, partial, or radical surgery. And so simple is just removal of the tumor itself, assuming it hasn't grown too much. Okay, partial is going to be removing part of the kidney, and that's called a partial nephrectomy. Okay, and then a radical nephrectomy is a complete removal of the kidney to remove the tumor, because now it's invaded too much of healthy tissue. Okay. Chemotherapy and radiation are going to always be staples in cancer treatments. Their effectiveness is going to depend on the state of the tumor and where it's located in the body. And then coping strategies for somebody with a Wilms tumor, or a child with Wilms tumor. So that is the end of this audio lecture over Wilms tumors. Until next time.